Last week, the hikoi dominated not just New Zealand headlines, but international headlines as well. There seems to be a fascination for things Te Ao Māori in the international media at the moment. That's not a bad thing, honestly. But whilst we were all having fun, something a little bit sneaky happening in Parliament. As a part of the requirement of the euthanasia legislation, there's a requirement for there to be a 3-year review, and that was sneaked through on Wednesday in amongst it all, and not many people noticed, including some people whose job it is to notice these things. Maryanne Spurdle from the Maxim Institute joins us. Maryanne, kia ora, good morning.
Good morning, Andrew.
Not wanting to throw you under the bus there, but actually you were keeping a pretty close eye on this one, and even you missed it when it was posted on Wednesday, right?
Yeah, and I know of others who've been waiting to see what this review has to say. We knew that they technically needed to release it by the end of the month.
Yep.
And, I subscribe to an RSS feed for the Ministry of Health, and they drop press releases on, everything,
Yep.
those ministries. Not a word. And so apparently it came out on Wednesday, and the first that any of my contacts noticed was Friday. So Friday morning, a bunch of us went, oh, it's out. We should have a look at what they've said, because they're not, ironically, talking about it. A big part of this report is encouraging access for everyone, and they want to make sure everybody knows that euthanasia is an option.
Wow.
They didn't want to talk about the report on euthanasia coming out. It's been very quiet on that front.
That is particularly ironic. But as I say, it was a legislative requirement, a statutory requirement. The 3-year review happened. They had to say, hey, this has what the impact of this legislation has had on our population. These are the cases. We've done the analysis. We've asked the tough questions. Was there much of that going on in the report?
Well, it's interesting. The way they kicked off was saying that it's largely working well, this legislation.
Okay.
They qualified it because, last time I spoke to you, the news had just come out that a couple of the official review committee, 2 of the 3 members,
Yep.
were no longer part of the committee. They had observed things that went against best practice. They were finding reports with important information like prognosis missing. And the Ministry of Health was telling them just assume everything's fine. So we already knew that it wasn't actually going smoothly.
Yep.
What this report digs into is what could be done better. And the fact that they're only now talking about things like training for people who perform euthanasia.
Wow.
The specific role of the review committee and the person who is supposed to review cases before before people die. They're only now saying, oh, this is exactly what your role is, and this is how you can prevent breaches from happening, because it was just toothless before. It's the first time they've suggested having legislation that has repercussions for intentional or accidental breaches, because this involves taking people's lives.
Yep.
And there was no, if this happens, then this person, needs to be reported here or there. There were no guidelines like that before. So it's good that they are addressing that, but the number of recommendations on that front just illustrate how poorly it is working. And then the other recommendations, they illustrate this tension between, now that it's legal,
Yep.
we all have a right to access it if we meet certain requirements.
Mm-hmm.
And so it's seen as a consumer right now. Well, there are also rights of vulnerable people. There are also rights of medical practitioners and care homes. And what this review does is suggest many changes that will swing things from, conscientious right to object to performing euthanasia. It's being seen very narrowly now as if you're not actually administering the lethal drug, you should be fine referring them to someone who can. As a care home, you should be fine allowing that to be performed on site. And it doesn't adequately address the rights of people who live in homes like that to not have their neighbors committing suicide.
Yeah.
To have medical professionals who can remove themselves entirely from the process without having requirements on them to participate in something that they don't see as good for their patients.
Mm. When it comes to, I suppose, best practice in here, it seems like there's a bit of a catch up on this one, which is Well, I mean, that in itself is a huge indictment, but rather than say, hey, here's some gaping holes in our process here, I mean, ironically, if you accidentally give a patient one too many Panadol, you have to fill in a report and go before a disciplinary committee in the health service. But we've had 3 years of people not being trained or even understanding what the parameters should be. And the report basically says, oh, this is something we could do better at.
Yeah, there's a real light touch when it comes to safeguards. And I think part of it is around this attitude that under the current law, these are people who are going to die soon anyway.
Yeah.
And in fact, there's a bias in this report towards preferring euthanasia over any other way of dying, like a natural death.
Yeah.
To the point that they want to remove hurdles that will lengthen the process, which at the moment is on average 3 weeks to get approved and another 3 weeks to actually have it completed.
Mm-hmm.
On average, 6 weeks is not very long when there is some understandable, I's that need dotting and T's that need crossing.
Yeah.
One of the reasons they want to remove some of those things and speed up the process is because some people are dying naturally before accessing euthanasia, and that's seen as a bad thing.
What?
The point of euthanasia is to end suffering, and if they die naturally before this process is completed, it's seen as a failure of the system. And I mean, that tells you something about the attitude towards medicalizing death.
Look, I can understand, for example, if somebody is on a waiting list for life-changing surgery, which will improve their quality of life, and whilst they're on that waiting list, they pass away, that is a broken system and needs fixing. But that same principle just does not make sense in the context of euthanasia.
It doesn't. And there's no self-reflection on that attitude in the report. It's just a given that since this is a consumer right to access it, if someone wants to and can't, then we must do something to fix things.
Wow.
Instead of recognizing that there are many options medically for many things, and it's great when we get our own choices, but the reality is we can't access them all. And as long as there's pain relief given when there's pain, you have assessments by professionals when you need them, those things are all in place. This is an option for people who, according to the legislation, are going to die soon. This is a different way of dying. And the really sad part about that attitude towards this is they keep hammering home the universal access, equitable access.
Yep.
Palliative care is something that does relieve pain, that does provide comfort, end-of-life care. It addresses the very things that the euthanasia law has been created to address. We don't have equitable access around the country to palliative care. Palliative care is allowing people to, not die in hospital, to have care in home, to have pain relief in home. It's a more wraparound service than you'd have if you ended up in hospital, gravely ill. The day before this report came out, there was one released, and I haven't read through the whole thing yet, and this is not a government initiative, this is private. There's been a 3-year pilot because apparently pediatric palliative care, there's only one publicly funded unit.
Wow.
It's at Starship. So outside of Auckland, there's no access to publicly funded palliative care for terminally ill kids.
Wow.
So this was a pilot showing how that could be scaled up. Less than $1 million is publicly given to it currently. They're recommending it be increased to $9 million, and there'd be actual access throughout the country. And they estimate that the cost savings for hospital admissions would be more like $22 million.
Wow.
So that's something that's positive, that doesn't have, the can of worms that this legislation has opened up. It's a 166-page report that just goes through all of these issues we now have to deal with.
Yeah.
Palliative care does not have any of those bad side effects. It's desperately needed. That's something positive that we should be focusing on to address the things that this is trying to and failing to.
Now, if sneaking it through during the hikoi wasn't enough, making it a 166-page report will probably put off everybody else. Thank you so much for the work that you've done in the analysis and breaking it down into key points and things that we could be concerned about. Now, this is a report tabled by the government. Is there any opportunity to have a conversation, to have feedback for members of the public to have input into this, or is that ship sailed?
The public input for this is obviously sailed, but I think we mentioned last time when I was chatting with you, there are two private members' bills that could be drawn. One is Tanya Unkovich's, which would require the Ministry of Health to provide better palliative care services. Okay. That would be real positive. The other is an ACT Party one that would, I think, remove the 6-month terminal diagnosis.
Yeah.
If that happens, then these issues that the report's dealing with, they just become even more critical, because now the door is open to people requesting it for different reasons than terminal diagnoses.
Yeah.
So we've got a whole other lot of issues. So those are things that might be discussed publicly before long.
Well, certainly something to keep an eye on there. And Maryanne, thank you so much for the work that you do. And this discussion document, this article is going to be posted, I understand, on the Maxim website a little bit later this week, maxim.org.nz. But thanks for what you do. Thanks for taking the time to chat with us today.
Thank you, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.